how local health departments and community organizations, or just community folks, are working together to end the HIV epidemic, and what does that engagement look like from both sides. And so we have joining us today Commander John Oguntomilade. He is a PACE officer with the National Community Engagement focused on ending the HIV epidemic. We also have Genevieve Barrow. She is the Assistant Director of the HIV STI Prevention Department in Baltimore City Health Department. And then we have Halenia Cruz. Halenia is the Deputy Director of Peace Inc. out of Memphis. So welcome. We are so very excited to have y'all here for this conversation, because it's a conversation that I'm sure you all have been having a lot, especially from folks wondering what is happening with this whole Ending the Epidemic Initiative. After Trump made that announcement in 2019, it seemed like, I know from us in Houston, it was just like boots on the ground. We just started running. So before we start running directly into this conversation, I want to ask y'all, we've been in a pandemic for almost 12 months. How are y'all finding joy in this moment?
Oh, wow. First, I just want to say thank you to you, Crystal and Drake. Thanks for having us on the show today, and congratulations on your second episode of the show. And just thanks for creating this space to have community folks and local and federal government people all come together to talk about some really important topics. So thanks for having us. I think I'm finding joy in the weather right now because it's not so cold, and I don't do well with cold weather. And those rare occasions that I get to hug my nieces and my nephews is just, they're just the best. I didn't even realize how much I was starving for hugs. So yeah, just the little things, the simple things in life are giving me joy.
Awesome. What about you, Halenia?
I want to say thank you to also on behalf of Peace and myself for inviting us to this great show, so we can speak on what we're doing and how we're doing it, especially during the pandemic. It's important. Some of us are having a harder time than others making it through the pandemic. So I think we have to kind of lean on each other for that advice and that knowledge, how to make it through. I think that I am a summer girl. I do like the heat like Genevieve, but I love Christmas time. And I am excited about the Mariah Carey Christmas album and all of the above. And just talking to others, our clients and people we reach out to about Christmas time, and hoping that they're excited if they're not, trying to get them excited with any resources we have that we can offer them. And just doing the work that we do and seeing people smile is how I get through.
John, how are you finding joy?
Oh, thank you. Thank you once again for having us. I'm excited to participate in this event. And just to hear, to be able to express things from the federal perspective on community engagement, and to be able to share this with your audience, I'm really appreciative of this. In this current environment, so much has happened and so much has changed. Having lived in the Washington, D.C., Maryland area for about 17 years and now relocated to the Atlanta region last year, I'm enjoying the fact that it's not as cold out here compared to DC, and it's just been a joy to be able to spend more time with the family, knowing fully well I don't travel as much as I would have done pre-COVID, and just enjoying that family time and looking forward to Thanksgiving and the holiday has just been great for me. So that's just how I find my joy. Thank you.
I love that.
Mm-hmm.
When we were thinking about this conversation, I'm sorry, Edry, go ahead.
I was just going to say, I'm also in Atlanta, John, so I echo what you said. The weather here it has been giving me life lately. We went through the rainy season, and now it's just like sort of a mini fall but late summer feel, and
Yeah.
gotta live it up while you can.
Oh yeah.
That's so true. In Houston, the weather is really nice. It's about 70 something. I don't have on a jacket, so I'm just really enjoying this going into December. So now that we've kind of shared where we are during the pandemic, a couple of things I think about when we're talking about ending the HIV epidemic. Sometimes it can feel like this very high level conversation, or it doesn't even feel that way. Sometimes it is a very high level conversation. And when we really think about the communities most impacted by HIV, where we live, John, you said you're in Atlanta?
Correct.
Okay, and so Genevieve is in Baltimore and Helena is in Memphis. If I was coming to your city, where would you take me? And it could be like the best restaurant. It can be like something cultural that you just had to show me. And I'll give you an example. Like in Houston, you know, we have a culture down here. Yes, you will find horses in the city. And we have a diverse culture of food. And so if you are Nigerian, I can take you to the best Nigerian spot. If you want some soul food or some barbecue, I can take you on the south side to really give you a feel of our culture. And then we have the best Mexican food, so on and so forth. So I think about this in terms of like really putting culture behind where we're from, because it tells a bigger story about our epidemics. So tell me something about Memphis, Helena. Where would you take me, and what does it say about Memphis?
So Memphis has so many things to do, although we always say that we don't have that many things to do here. But if you are a tourist and look at a tourist guide, you'll be like, wow, 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 wow. For music lovers, we have the Sax Music Museum, which would showcase Motown and all those big stars that started out like Diana Ross, which is my favorite. All the glam, as you can see. I would have to take you there. If you like rock and urban stuff, I would definitely take you by Elvis Presley's house. Funny thing is, I grew up in Saltillo, which is right outside of Tupelo, and his birth house is there. And I live here in Memphis now, where his actual house that he lived in is. So I would take you by there. I would take you by the Civil Rights Museum, where Dr. Martin Luther King experienced his crossing over. And we have Proud. I tell people all the time, although Memphis is small and we seemingly don't have a lot, we have a high poverty level. We've had a lot of great influential people come out of Memphis, and Dr. Martin Luther King was here with us. So be proud of that. I would take you there. I would take you to some really nice tropical nightclubs. My father being Puerto Rican and my mom being Black, I like to do all of the island stuff. I would take you there. We could get some good Puerto Rican food. Probably not as good where you are, because I'm sure there's a larger community, but it's pretty good. And I would take you to some of the parks and stuff where I go to decompress after working all week. Parks I think that are really beautiful. I meditate there. Riverside Park, where you can actually see the Mississippi River. We have the largest piece of the Mississippi River here in Memphis. I think that's awesome. The pyramid is right there. So that's where I can take you a lot of places. To the office, Pea's office, it's amazing because I work there. So we have our ANEA groups there. Introduce you to the ANEA girls. I don't think you'd be bored if you came to Memphis. So.
What about you, Genevieve? Tell me something about Baltimore, because like I started The Wire at the beginning of COVID, so you know I feel like I know a little bit, but maybe that's not accurate.
Listen, if I had one more person reference The Wire when talking about Baltimore, Baltimore is so much more than The Wire, okay? But the one thing that we do love here in Baltimore is our seafood, right? Maryland crab cakes, crabs, 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 the kind that you eat. We love our seafood here, so definitely take you to an array of seafood restaurants in Baltimore City. Of course, we love sports. You have the Ravens. Maybe we could check out a Ravens game, or the Orioles. What else? Oh, the museums, the Baltimore Museum of Art, the Reginald F. Lewis Museum. That's another good place to go to take in some African American history. Um, yeah, I think those are like, the main places to go besides, what you saw on the wire, Crystal. We have, we love our food, so we can go on a whole eating tour of Baltimore City.
I'll have to take you up on that. I'm definitely down for that.
All right.
What about you, John? I feel like Atlanta might be one of those cities that's more well known, especially with their cultural scene and their in terms of like their HIV epidemic. But what else would you say about Atlanta? What would you share?
Yeah, relatively newer to Atlanta, but Atlanta is a beautiful city. If you come downtown, there's a lot to see. There are lots of places to go. And Atlanta is a city that has a clash of multiple cultures. You have African Americans, Hispanics, Asians, and people from multiple countries. So it's such a beautiful city with lots of diversity, and you would enjoy that so much. One good thing I like about Atlanta is the food. You have a variety of restaurants. I particularly like Thai food, and I have one pretty close to where I live. And they have good takeout. So if you don't have to dine in during the pandemic, you can easily order some great Thai food and get them to your home. But as a result of this pandemic, there's not been too much we've been doing outside, but we've just been able to enjoy a lot of going around the parks and just enjoying the city. Sometimes we have a lot of big malls in Atlanta, and we've already been able to enjoy going around. The Mall of Georgia is out there, further down, and it's a good place to enjoy yourself. Go out with the family, work around on Saturdays. It's a safe place to be. But if you were to come to Atlanta, I'll take you out to a good restaurant, and I'm sure you'd enjoy yourself out there.
I love that. So since we are talking about, sharing with our cities, sharing with everybody, like just these key things about our cities, John, I wanted you to also share a little bit about the PACE program. I think it's a new program, so can you just break it down to us? What is it and what is its purpose?
Okay, I think that is very important. I think the first thing I would say is PACE represents prevention through active community engagement. Um, as a result of the presidential initiative that was announced at the State of the Union address in 2019, there was a plan identified as Ending the HIV Epidemic, a plan for America. And that plan looked at where we had most of the new HIV infections and devised a plan towards addressing the epidemic at the core of the epidemic. So about 48 jurisdictions were identified, which includes San Juan, Puerto Rico, and Washington, D.C., then about 7 states that have substantial rural burden of HIV. Those were also identified, and those were identified as having about 50% of the new HIV infections. As such, a plan was devised across the various operating divisions in the Department of Health and Human Services, which include HRSA, CDC, NIH, SAMHSA, and all the operating divisions, to come up with a plan, a comprehensive plan to ensure that we reduce the number of HIV infections by 75% in 2025 and by 90% in 2030. We've just completed the first year of that program. So we have, it's a 10-year initiative. We just completed the first year. So we have 9 years left. So PACE was established in 3 regions. Region 4 Region 4 in Atlanta, covering about 8 states within the Southeast, Region 6 in Dallas, covering 4 states, then in Region 9 in Los Angeles, covering 3 states and about 10 priority jurisdictions. In Region 4, where I'm stationed, we have about 13 priority jurisdictions, and the work of PACE is actually to work in concert with the federal partners across the various operating divisions, the state partners, the county partners, and community partners towards ending this HIV epidemic. So we serve as the lead point of contact for ending the HIV epidemic in the regions where we're assigned. We spearhead the initiative in partnership with individual federal agencies and non-federal agencies. We develop, implement public health interventions through community engagement processes, and we serve as trusted partners of the community to increase the ending of the HIV epidemic awareness and community participation, and we connect community groups with existing HIV resources within their jurisdiction. So in a nutshell, that is what PACE does. The PACE program consists of U.S. Public Health Service Commission officers. That's why I'm in uniform today. And we have teams in these 3 regions, Region 4, Region 6, and Region 9, carrying out these activities in collaboration with all the partners.
That's awesome. Thank you for sharing about that. I'm going to jump in here because I think it's a good segue to also talk about, we have this federal initiative that has been around since 2019, and I know y'all have put a lot of good work and thought into hiring and engaged key communities, but the HIV community, we know, has not been silent, and they were asking for a federal strategy for a while. They pressured President Obama to come up with a national HIV/AIDS strategy that led to, or at least inspired, some of the components of the EHE initiative that we know today. But ANEA, in partnership with organizations like AIDS United and over 350 other community-based organizations, put out our own roadmap to end the epidemic by 2025 that also helped spearhead some of those ideas and concepts integral to EHE. So just a quick little thing on language. When we use EHE, that usually means we're referring to the federal initiative. When we use ETE, we're talking about community-based programs that are running their own ending the epidemic projects for specific communities. And sometimes there's overlap with the federal program and sometimes there's not. So ANEA was actually able to give a small round of mini grants to several community-based organizations, mostly in the South. So Halenia, I know we gave Peas Inc. a grant, and I'm just curious as to what do you think the core components that you knew needed to be included in your ETE program were for your particular communities there in Memphis?
The core component was going to be able to create a group of girls that would be spread out from what I wanted to be the ages of 18 to 40, and these girls specifically being transgender women, because that is one of the demographics that is affected so dramatically by this epidemic. So in doing that, I was very intentional in making sure to meet that age gap that I needed, and also to try to pick girls from all different walks of life so that we could get their input on the actual EHE draft. And input in and around what they thought was working, what they thought was lacking, and what they thought we needed. And so going through the pillars, we composed questions, PowerPoints, panels, roundtable discussions, just all different types of things to gather that information to be able to present back to you all, so we can try to implement those things in some type of way, shape, and form, so that we can continue to move towards ending the epidemic.
I want to, so this question really can go to everybody. Like when you're thinking about how to structure the work of ending the epidemic using the federal money, what were some of the things that you really knew you needed to include And Genevieve, I think about the work that you all have been doing in Baltimore, which has been really incredible work, even before the EHE resources hit the bank, right? So what were some of those things that you knew Baltimore City Health Department needed to incorporate in your plan?
Yeah, thanks, Crystal. And thanks for recognizing the fact that people all around the country have been putting in the work way before the federal resources were released, or this new label, ending the epidemic was put on the work that HIV community folks have been doing for decades. One of a good point of engagement for us has been definitely community engagement, but we started this in Baltimore City since I would say around 2015. Well, let me take a step back. I think community engagement is something that happens on a daily basis for health departments. So whether it's our DIS, our outreach, DIS is disease intervention specialists, our outreach staff, the work that we do on a daily basis involves community engagement. When you're out on the street trying to talk to people and trying to get them to understand the importance of knowing their status, linking people to care, that's all community engagement. But we started some specific priority population engagement back in 2015, 2016, when we received money from the CDC for our Thrive grant, right? Trying to create these safe spaces for folks to come together to share their stories. So one of our big initiatives that was really designed or developed by our really ingenious social innovation team led by Kehinde Bademosi was Baltimore in Conversation. So what that was a storytelling, a platform where people community folks, like everyday community folks, could have this platform that's stigma-free, judgment-free, and talk and share their real lived experiences, their experiences with stigma, their experiences just with medical mistrust. And in that space, we would have medical doctors and politicians and everyone else from the Baltimore wider community sit in the audience and hear people really talk about their stories and their experiences. And we really feel like we felt like those initial types of engagement opportunities really helped lay the foundation for the continued community engagement efforts that we've had in Baltimore City since. So we have Baltimore in Conversation, Baltimore in Action. We have Project Presence. You can definitely look up the Baltimore in Conversation on Facebook, and you'll see a lot of the videos and all of the wonderful pictures and portraits of everyday community members in Baltimore City that really, really helped to, like I said, inform how we went about addressing our community needs. So that started back about 5 years ago. And then we started with these tiny little cell conversations, really intimate group of folks, people who are from the community, engaging with their friends and community members and having these really intimate conversations. And through that, we're able to get some really good foundational information about what is it that should be incorporated into this federal plan. Of course, the EHE plan from the federal government has the 4 pillars. In Baltimore City, we added a 5th pillar called the foundational pillar, and it's about education, transformation, information. So that's the pillar where we're doing all of our social media outreach, our ways to different ways to break stigma and discrimination, to address health literacy in general. For all. So yeah, we've had so many different stakeholder groups that we've included in this conversation to really take what the federal government, the blueprint, the framework that was given to us by the federal government, and really incorporate local local needs and different strategies into that plan. I
love that, and I wrote in the chat Baltimore in Conversation for those of you in the Zoom room who haven't checked out Baltimore in Conversation, I encourage you to look it up. It's really powerful. And it struck me the first time I learned about it, it might have been 2 years ago. Just the way that you frame the conversations around community and you allow community to share. I thought that was so powerful. And I follow you on Facebook, so I liked it. I liked the Facebook page, and I followed the work that y'all have been doing. And to me, I don't know how it feels to you because you work on the inside, but to me, as someone who is like a public, in the public or in the community, it seemed to me like you all were able to like easily pivot during COVID. And this was a time when EHE was already in the planning stages, and we had to start doing community engagement. Like, what would you say are some of the key reasons or the systems or infrastructure you had in place to allow you to be successful in pivoting in a pandemic?
Yeah, thanks, Crystal. And thanks for recognizing the work that our team does here in Baltimore City. But like I said, the fact that we had started those conversations a while ago, and we're intentional about it, because community engagement can be community engaged, has to be meaningful, right? We've had those intimate conversations with different priority populations all around the city for a while. And so when you do those kinds of, make those kinds of efforts, you're building trust, right? And representation matters. It depends on who's leading these conversations, who's having these conversations. So we did our best to make sure that we had community members leading some of these conversations, and really compensated for their time and contributing to Baltimore, to the plan development and to these really, really rich conversations. So yeah. It's been going on for a while, and we really think that community engagement is an ongoing process, right? It's not the end point. It's something that it's iterative. We have to continue to do it. Even after we've submitted this plan to the CDC in December, it's an ongoing process to make sure that we are really capturing community voices all along the way and making sure that we're being accountable, to the folks that we've engaged.
Thank you for bringing us back to trust, Genevieve. I really feel that deeply. It's so important and crucial to build trust, and it's one of those things, so like you said, it's not a one-time checkbox. It takes time. And so, Halenia, I'm curious as to what y'all have been doing at Peace Inc. to build some of that trust, and sort of what the history beyond the Ending the Epidemic work at Peace Inc. How have y'all built that trusting relationship with the transgender community there?
So I want to say that Peace has been around since 2009. My first interaction with Peace was actually I was not a member, but a participant. And I went to one of the programs that they had. And at that point, I realized that all of the college education that I had and experience I had in adult sex life, that I was lacking just crucial knowledge when it came to in and around STDs and HIV, things that I thought I was educated on. So being a part of that, I realized that I wanted to be a bigger part of that. And meeting the executive director, Laronia Sawyer, I want to say that first and foremost, the trust starts with her. She's very genuine, very intentional, and I feel that any organization that's going to be an outreach organization has to be just that. You have to have employees from the top to the bottom who are intentional and who are genuine, because people can feel energy, okay? And that's off of the logistics of being professional, but that's being a human, okay? Then moving into the charting aspect of things and the professionalism, I believe that you have to ask people what they need. And in asking people what they need, they feel that you are intentional and genuine, and they feel that you care because you're asking. not just giving what you think they need, but asking them, what can we do for you? Or what do you need? Or what do you want even? It's not always about need. Sometimes it's a want, because we cater to both. So in saying that, I want to say that us as an organization, my ED was very intentional in hiring people that look like the people that we were going to serve, number one. All of those people are intentional in being genuine and actually want to ask the community what they need and want, and number two. And number three, putting programs into place that are actually going to benefit the community. So number three. So in doing that, I feel like we have gained their trust because we hire from within the community. Um, and we really do go out there and ask, what is it that we can do for you? So I think that's the key.
I want to ask you a follow-up question, Halenia. So you work for a community organization, right?
Yes, yes, yes.
How do you feel like you have been engaged or your organization has been engaged by your health department, especially if your health department is receiving or is the recipient of the EHE resources?
So I want to say that again, I have to step back to speaking to Laronia Sawyer, who's the ED executive director. She actually came in with a close relationship with our health department. Okay, so that kind of gave us a one up to where we can reach out and see if there are multiple tests being given to the same person, or if this person had already tested positive prior to our being testing them positive the first go round. So we can say, you know, hey, you're not a new positive, but these are the resources we have for you already testing positive. Let us help you here. You know, why are you testing so much? Is it because there was an incentive involved? So if that's the reason, we can give you this, we can give you this. Don't worry about, you know, continuing the test when you already know your status. Let us use those tests for somebody who doesn't know their status. Those resources for people who need them, and we have another resource for you over here. So I think that it is important for community-based organizations to reach out and try to create a relationship with their health departments and other organizations, because working together, you cover more ground and you're able to be more effective. So not feeling as if one sector is better than the other, but feeling that we're all in this together is the key component, I believe.
I love that. And I'm curious, I want to hear from you, John, or on the flip side of that is, you hear a lot like, well, that community is just hard to reach, or at least you used to hear that a lot when I was working at some departments of public health, like these hard to reach communities. So in your role, or just what have you heard as far as good advice that you would give to a health department that is struggling to reach some of those communities that are a little bit hard to reach?
Thank you very much, Edric, for that. And still just looking at community engagement from a broader perspective, it's important that we work to ensure we're not just doing certain outreaches to communities, but going deep down to engage the communities, which involves a process of building relationships and ensuring community participation in the interventions that are being designed. Many jurisdictions have come up with different challenges in this process of community engagement, and also with the pandemic, it has been an additional layer of challenge for them. But one of the things that we usually encourage our various jurisdictions to do is, first of all, for them to understand that there are various types of communities, and because of this, they have to look at the data that is available, and based on that, have interventions that are very disaggregated based on geography within your state, within the various counties, within the rural and the urban communities. The interventions may need to be different. Look at the racial distribution of the data to determine where the interventions are most where the intervention should be directed, look at the age distribution, the racial distribution, the health risk behaviors, look at the unique attributes of the communities. Are there medical mistrust in these communities? Is there stigma in these communities? What are the social determinants of health? What are the confidentiality issues? Do they have respectful engagement with the LGBTQ community? What are the needs of the providers? Do the providers have capacity for cultural humility in their approach? How are they integrating HIV services with the primary care setting? What is the level of education and awareness for the communities to generate demand for certain services? But one of the things that we've also learned to a large extent is for there to be an intentional approach towards outreach to communities. There are communities that if you come as the government and you just want to reach out to them, many times because they don't have a relationship with you, and there's no trust, you really can't reach out to them effectively. But we've seen some best practices, and we as the PACE program, we often share some of the best practices that we have seen in the various communities. For instance, in my region, I cover 8 states, and my states also include some of the 4 of the 7 states that have significant rural burden of HIV. One of the things that we learned in Mecklenburg County, North Carolina, was how the state worked very actively with certain stakeholders within the community and influencers within the community to reach certain community groups. One of the community groups within Mecklenburg County, North Carolina, that needed a lot of attention are the young Black MSM community. Then they were able to reach out to social media influencers. They actually went on certain dating websites that these communities often frequented. And what they did was they used members of those communities to put out messages on those websites, and based on that, they were able to have certain conversations and begin to draw out that community into the setting where they could discuss the most effective interventions for these communities. One thing that is also very important that we share is the fact that we need to look at these challenges from a social ecological perspective if we want sustainable interventions. So when we talk about a social ecological perspective, we look at the individual attributes, we look at the relationship attributes, we look at the community attributes and the societal attributes to the extent to which we can say, even if there are issues with the individual and the individual wants to reach out, there could be other factors within the community and relationship and society at large that impact the ability for this particular individual to get the help that they need. As such, in our interventions, we have to make them holistic in approach. There are people that have housing insecurities. We have to work with the Hopwood programs to ensure that those housing insecurities, there are various social determinants of health that a purely biomedical approach can be very limited, not looking at the holistic challenges that impact those individuals. So in this planning process, the CDC has encouraged a lot of active community engagement so that people don't have broad stroke plans. Don't assume you know the needs of the community. Don't assume you know the community more than they know themselves. Engage them. Find out what they need. Work with them to determine what strategies will be most impactful for those communities. Include them in the plans, because we know that in the US, over the years, we've had a total of about we started from about new infections from about 100,000 a year in the 80s. We moved down till about to about 50,000 in 2014, and now we've been ranging between that 40,000 and 37,000 new infections. And we know that if we continue to do what we have been doing, there's a possibility to have 400,000 new cases in the next 10 years. And that was why this ending of the HIV epidemic plan came to being, not because not so much work has been done in the past. A lot of work has been done through the Ryan White programs, CDC grants, and all that. But last year, this initiative came out as an intensive approach towards trying to end this HIV epidemic within the next 10 years. From my experience working globally, I realized that multiple countries with limited resources have been able to make a lot of progress. And now coming back to the US domestic aspect of the work, with all the resources we have in the country, I believe we're at a point where we can really move the needle and make a significant change? I think that must have been a long answer to a short question, but I wanted to give you the holistic way in which we're looking at it.
I love that, and I think that was a really great, and I really appreciate that you included kind of a concrete example from, you said North Carolina, right?
Correct.
I want to know, it made me think about a couple of things. So there are a lot of organizations and positions that have been created on the federal level to help support EHE work. I think about the work that our CEBA providers or our capacity building assistance providers like NASDAQ or AIDS United. There are many entities providing support. What is the best way that we should be engaging our PACE officers in this work? Because there's a lot of moving parts, and I'm not sure that I'm even 100% clear on how to engage you all and how you can help support the work that community is doing.
Thank you so much for that question. And I think that is a very critical question. And I think through Edric, I'm going to leave contacts for the PACE officers and the PACE program so that you can share it broadly with the audience. But one of the important aspects of the PACE program is we work and we report directly to the Office of the Assistant Secretary of Health. And we work across the various federal partners. Many jurisdictions receive grants from CDC, HRSA, SAMHSA, NIH, and many IHS-related grants. But we do not work for one of those institutions, but we work across the board because we report to the Office of the Assistant Secretary. So we can help to break down silos. Many particular funding agencies have their streamlined reporting requirements, and many programs are very intertwined to each other. And we as a PACE program, we can look at things from a holistic perspective, try to break down silos from the community in program implementation at the community level, then work with community organizations. We've been having very, very excellent relationship with the Black AIDS Institute. We've been having very excellent relationship with the CFAS, NIH, CFAS Centers for AIDS Research. We've been having excellent relationship with the primary care associations. We've been having excellent relationship with the Southern AIDS Coalition. We have so much of these relationships that we work with hand in hand, and things that we learn from these relationships, we share them with the states and with the various jurisdictions to let them know some of the unique attributes within the community served, so that these plans that they're developing would have all these various ingredients within them. But as PACE officers, we help to break down silos. We work both on the community level to understand the community attributes and bring it up to the state, and we also bring it up to the federal level to ensure that when programs are being implemented, programs are being released, they come in with those particular attributes that we're learning from the state. Many community-based organizations have reached out to us directly, and we've been able to form a good partnership and trusting relationship with them so that their issues and concerns, we can raise them up and we can also connect them to resources that we need. But I'm going to be able to share all our information of the PACE officers so that you can have them. And for people looking for resources, the hiv.gov website is an excellent resource for many things that are happening regarding ending of the HIV epidemic.
Thank you. So I want to let everybody know that we're about to open it up for questions, and we have some comments and things coming through on Facebook, but you can also unmute yourself or type it into the chat. And as you're getting your questions ready, I wanted to ask you just one more follow-up, John. So I know communities, like our community in particular in Houston, we have 2 local plans, and we've been working to develop one plan. We also know that as we work to develop one plan, we're thinking about the requirements that CDC and HRSA has to have a comprehensive plan in place. And how is that working with the EHE plan? So I think there's been some confusion and some hope that there would be guidance given to help local planning bodies and communities know that, hey, yes, you can develop one plan and we will give you guidance. CDC, HRSA will give guidance to let you know what to include so that you don't have to have duplicate plans in your area. So is that something that the PACE officers can help with, or is that something for another department within our federal government?
So one of the things that the PACE officers have been doing is actively participating many times in the community engagement and EHE planning meetings. For instance, I'm stationed here in Georgia. I've been participating in the Georgia meetings, and in many other states within the jurisdictions that I work with, they've been inviting me to many of the virtual meetings where I've been able to provide additional guidance. One of the key aspects of this ending of the HIV epidemic is that it recognizes that there's so much work that has already been done. As Genevieve mentioned, in Baltimore, even before ending the HIV epidemic plans, they've been working on multiple plans. But now we're getting to a point where we want people to look at things from a holistic perspective. There are multiple, maybe county plans, there's different state plans, but we have limited amount of resources, and we want to a large extent to ensure that the resources that we have are directed towards the most efficient and effective ways to get the most results. So when we look at all the plans as a whole, we wouldn't want there to be a lot of duplications. So if the state can look at the various plans and see where the gaps are, we wouldn't want to fund something that's already funded by another plan, but we want to understand where the gaps are, where the places where we can plug the holes, where the significant gaps that can improve program outcomes, where the places that we believe that the needs are the most. And based on that, when everybody comes together, we identify those areas and we prioritize those areas for funding that will help us to end the HIV epidemic. So I believe the PACE officers in your region can also provide a lot of technical assistance in reviewing those plans with you and helping you in the process of consolidating those plans and identifying areas that are specifically important. But one caveat that I'll also give is many times we have direct funding relationships. Agencies have direct funding relationships with CDC, HRSA, NIH, and all that. And the PACE officers do not take the place of those funding agencies. They are project officers that have fiduciary responsibility over those grants. We can provide some form of guidance, technical assistance, and help, but the official response for those applications and all that really come directly from those agencies because they maintain those funding mechanisms. But we work across the board to support the work that all the agencies are doing.
And if I may add rather quickly, in Baltimore, we really were intentional about having all of our planning bodies, the HIV Planning Group, the HPG, and the Ryan White Planning Council all participate in, be members of the community engagement around developing our EHE plan. And so we also work with our Ryan White department as well. They're part of the internal EHE work group just to make sure that even though we have separate funding sources, we're all working together on one plan for Baltimore City. And the good thing about the EHE is that the federal guidance did say that it's supposed to build upon existing plans, so it's not duplicative or trying to create a whole nother plan. It's building upon what's already established. So as John mentioned, looking at those gaps in state plan versus city plan and whatnot, and trying to figure out, okay, what are the community needs that are not being supported in either of these plans, and then making sure it's incorporated into the strategies moving forward. But yeah, so we're very intentional in Baltimore about making sure that everybody is sitting at that table.
Excellent. Thank you all for this great conversation. I feel like I'm learning a lot as I hear y'all talk. And just a reminder, we do have the ability to unmute you if you want to go on the air and ask your question live. If you're joining us via Zoom, or type your question in the chat. We're also tracking the Facebook comments, so please ask your questions there. Can't believe our time is almost up. I definitely don't want to walk away from today's show without asking a question about the future and just like doing some visioning with you all. So Halenia, I'll let you start with this next question is, just imagine there was no red tape, no limits to what your work in Memphis could look like for your community. How would that change your work? What would you do if there were no limits?
If there were no limits, wow. Like, first I want to say that going forward, I always try to encourage my team to look at what we call clients as partners, community partners, because they're a partner to us. Actually, we're partnering with them to be a part of their change, their healthcare. They're moving forward or moving out of situations that aren't conducive to good living. So they are our community partners as well as other organizations are. So working with our partners, just being able to holistically help them in any and every way that we can. Because as John spoke about earlier, if you don't address those underlying issues first, that all of the work above is almost pointless. So if we had funding to address addiction, to address depression, to address anxiety, to address all of these situations that have probably led us to where they are a part of the epidemic now, or could lead us to being, or could lead them to being a part of the epidemic, and addressing those earlier wouldn't, it would just really, I think, speed up the end to the epidemic. So to have unlimited funding to address pre-existing conditions would be awesome if I could do anything and have everything. To offer housing to anyone and everyone who doesn't have it, to offer education to those who might have missed out on it, to offer the love that my parents gave me to all of the above who didn't get it, because that's so important. Support, 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 support will take you to a level that you never thought you could go to. And a lot of people who we are helping didn't have that love and support. So if I could offer all of the above, I would. A continuum of the ANEA group, because it has moved us so far, but you know, grant monies only go so far. And just a continuum of everything that we do. I would just probably forever and ever and ever until I can't work anymore, because it's not really work. It's your dream. I would do it until I died. So.
Thank you for that great answer, bringing us back to all the aspects of well-being. We're not just ending HIV, but we've got to learn how to love all the communities that have been told they're not worthy of love, right? So we do have someone who would like to ask a question. I believe it's Tana. You're
Hi,
unmuted if you want to ask your question.
yes, my name is Tana. I have a question on this EHE plan. How do you, as an organization, involve Black women that have families, and the time that most of these meetings are being done is at a time that we are not able to be around these tables, and also for women that have children that needs to be around this table to be engaged in every aspect of implementing things that are designed for Black women and Latinx women.
Can I give a suggestion on answering that? So one of the things that we did when we started our EHE plan, and of course our plan was specifically driven to Black trans women, but this would work for Black cis women as well, is being open to options. So in our meetings, if you couldn't make an in-person meeting, you could be there via phone. You could be there via Zoom. So just because you weren't able to physically be there didn't mean you couldn't be there. My laptop was there, the COO's laptop was there, my phone was there, and if you couldn't in person make the meeting, you could make it virtually. So that actually was an easy transition when we had to go all the way to virtual, because that option was always there. So people being a little bit more flexible, I think, is going to be the goal for that. Creative, innovative, and flexible.
That's a good point. And I think it's also important to not just invite people to our table at the health department, but it's important to go to their tables. So in terms of timing and flexibility and scheduling of meetings, I think it's really important that health departments make an intentional effort of going to communities where folks are already gathering, events, look for opportunities, community-based organizations that reach these different priority populations, support their efforts, and perhaps have those community members be the ones to really be the messengers for the EHE plan to get folks engaged in those conversations. One of our efforts in Baltimore City is around reaching out to our barbershop and beauty salon coalitions. So, you know, the conversation doesn't need to happen in a conference room at the health department. It can happen while your beautician, your stylist is doing your hair. You know, that's another form of community outreach that we are really pushing in Baltimore City. So being flexible and not expecting folks to come to your table, but meeting them where they are, I think it's really, really key in order to meet, you know, the complexities of people's scheduling, and not only scheduling, but people's priorities as well. I mean, we talk about the COVID-19 pandemic. Where does ending the HIV pandemic fit into dealing with COVID, elections, and everything else that's going on? So in terms of just trying to be intentional about being flexible and meeting people where they are, I think is really key in reaching folks. And also, it's not just about, you know, hard to reach populations. It's about, well, how accessible are our services? Let's rethink how we're giving, providing services to the community. You know, 9 to 5 is quite important.
I just wanted to add something, because even what you're saying, and I know, Edric, we're about to wrap up, but Genevieve, even what you shared, and Halenia, what you shared, I think about a couple of things in terms of what the work of a health department and the work specifically of your health department, Genevieve. It sounds like there was a shift that you all intentionally did to adapt to the time, because we have been talking about outreach and community engagement. We are now in a virtual space, and we were already we were living in a virtual world beforehand, but you actually shifted your programs to change with the times. So outreach does not always look like in person all the time. There is some outreach done through social media, but also you're thinking about who you are in your community and within your community outside of your clock in, clock out, 9 to 5. You go get your hair done, you go to the grocery stores. What are those conversations like? How are you engaging that? And that does not always take money.
Right, right. Where are those points of contact that we can actually reach people instead of, you know, I know everybody's zoomed out, right? Nobody wants another Zoom meeting. So where are folks gathering, and how can we support those conversations in those spaces? It's very, very important.
So this is John. I just wanted to make a quick plug in. This December 1st is World AIDS Day, and the HHS, Department of Health and Human Services, has provided a theme for the World AIDS Day, and the theme is Ending the HIV Epidemic, Resilience and Impact. Resilience and impact. And the essence of this is we're in challenging times with COVID pandemic and its mitigation activities. And for us to continue to work on ending the HIV epidemic, we have to be very resilient, and we have to be strategic, innovative to ensure that we continue to be impactful. And one of the ways we can do that, when we look at the pillars of ending the HIV epidemic, we can think about things like self-testing to optimize the diagnose pillar. We can think of leveraging STI clinics and primary care settings for HIV opt-out testing. When we look at the treatment pillar, we can continue to look at the various HIV telehealth modalities, even as people don't readily go out to multiple facilities right now, to optimize our various care and treatment services. We can look at things like teleprep. There are multiple programs out there that we can do. We can continue our virtual navigation case management processes to ensure that these wraparound services that help us to get optimal program outcomes, HIV program outcomes, are still in place. So these are times for innovations. These are times for strategic innovations, but yet we have to be very resilient at this time, and we have to be strategic to ensure we continue to be impactful. So I just wanted to leave with those two words as the HHS was a theme that we should be resilient and impactful. And on the HHS website, the hiv.gov, you will see a lot of programs like the Ready, Set, Prep program that is designed to increase enrollment and uptake of PrEP services. We can learn a lot from there, and multiple social media posts and downloadable posters and even audio clips that we can send around to our partners to learn more about HIV, to learn more about the various services where they can get access to PrEP and the like. So I just wanted to put in that plug concerning the theme of World AIDS Day. Thank you very much.
Thank you for the reminder for World AIDS Day next week. Go ahead, Genevieve.
No, I was just going to quickly say that our Baltimore City draft Ending the HIV plan is on a website. So End HIV Baltimore is where you can find the plan and all other information around HIV in Baltimore City.
Awesome. Well, I was just going to say, in addition to all of those great ways to be involved, that ANEA is a resource, and right now, yeah, we're all continuing to innovate, but the need for community is still strong, even as we remain physically distant. So I hope that all of our guests today and everyone who joined us in the Facebook and Zoom can consider yourselves friends, forever friends of ANEA, and reach out to us if you need anything. Please help us elevate your work. And let's remember, we're not doing this alone. We're in it together. So thank you, everyone, for making the time today. And we're taking a break next month, but we will see y'all in 2021.
Thank you very much for having us.
Take care, everybody. Have a good holiday.
You too.
You too.